Good morning, everybody. My name is Ben Tomczyk on behalf of the Committee for a Responsible Federal Budget. Thank you so much for joining us for this morning's program, What's New in the 2022 Social Security and Medicare Trustees Reports. Before we get started, just a few housekeeping reminders. We are recording this webinar for future use. We are also live streaming it on Facebook and live tweeting it on Twitter at the handle @BudgetHawks. We encourage you to join in on the virtual conversation. Additionally, we hope to make today's event as conversational as possible. So please, as always, we encourage you to submit your questions to the panel using the Q&A feature at the bottom of your screen. If you'd like to direct your questions to a specific panelist, please be sure to note their name and we'll make sure that they see that. As many of you know, last Thursday, the Social Security and Medicare Trustees released their annual reports on the state of the trust funds. And today we're going to dive into what was in those reports, what are the status of these programs, and what does the solvency look like for these programs moving forward. And to help kick off that conversation, I'd now like to introduce my colleague, Marc Goldwein, Senior Vice President at the Committee for a Responsible Federal Budget.
Well, thank you so much, everyone, for being here. Good morning to all, and good too early in the morning for those of us joining us from the West Coast. Last week, and Ben's just going to pull up my slide deck while doing this intro here. But last week, as you all know, the Social Security and Medicare Trustees released their annual reports on the state of those programs. And overall, not surprisingly, the picture is quite troubling. We're just going to load this up right now, but if you look at the insolvency dates of the program on the next slide, please, what you'll see is that according to the trustees, the Medicare Hospital Insurance Trust Fund, that's Part A that covers hospital benefits, is projected to be insolvent by 2028. The theoretically combined Social Security Trust Fund, Old Age and Disability by 2035. That means that if you're a new young retiree at age 62 today, you're going to be 68 when the Medicare Trust Fund runs out of money, and you're going to be 75 years old when the Social Security Trust Fund does. Under current law, these programs are not fully funded to pay for current benefits. The Old Age Fund itself is actually projected to run out even a year earlier than that, 2034. On the other hand, the Disability Trust Fund, if you go to the next slide, is actually projected to remain solvent for the entire 75-year window for the first time since 1983. Even though these are all quite perilous, there are improvements in each case relative to last year. We thought the Hospital Insurance Trust Fund was going to be insolvent in 2026, now it's 2028. We thought overall Social Security was going to be 2034, now it's 2035. And again, the Disability Trust Fund is now going to be solvent through, through the end of this century under current projections. So that's good news overall. But while we've maybe gained a year, or in some cases two, of solvency, we've lost a year by waiting to act. And so we're pretty much the same off as we were before. Next slide, please. If we look at Social Security in particular, what we see, this is measured relative to taxable payroll. So it's almost by definition, the payroll tax revenue remains pretty steady. But what we see is relative to that revenue, benefits are continuing to rise. As recently as 2010, benefits and revenues were even. For the 2 decades prior, we actually had extra revenue coming into the program. But now with our population aging, as the baby boomers retire, the lower birth rates, rising life expectancy, what we see is that scheduled benefits are way in excess of dedicated revenue. The law says that when the trust fund runs out of money, we can only pay what we're raising, which means about a 20% across the board benefit cut. Next slide, please. We like to measure this as 75-year solvency and sort of a present value measure as percent of payroll. This basically means like, how much would you have to raise the payroll tax rate today to make it solvent over 75 years? And the solvency gap is 3.4% of payroll. That's a little bit lower than last year, but it's significantly higher than any year prior. So we're at sort of the second largest 75-year gap. It would take a significant amount to close this gap. Next slide, please. For example, we could raise the payroll tax by about a quarter. We could cut all benefits by about a fifth, or we could cut benefits for new beneficiaries by about a quarter. If we did any of those today, we'd be solvent for 75 years. On the other hand, if we wait until the deadline, we wait until 2035, those tax increases would be about a third. The benefit cuts for all beneficiaries would be a quarter. And you literally even if you eliminated benefits for new beneficiaries, could not do enough to restore solvency. Next slide, please. The Medicare situation is maybe not quite as bad as Social Security under current law, but nonetheless quite challenging. The same drivers that are driving Social Security are driving Medicare. More people are entering the program. The difference with Medicare is we have this extra tax we enacted during the Affordable Care Act, a surtax that captures more revenue over time. And so even though our spending is going up like Social Security, our revenue is going up a bit to catch it. Still, the trust fund is projected to be insolvent in 2028 when there'd be a 10% across the board cut in spending, and it's projected to remain insolvent, a solvency of about 0.7% of payroll, which is a slightly different measure over that period. Next slide. I should also mention that those projections assume that we basically continue to really hold down hospital payments. That's been very helpful in keeping Medicare costs under control now. It's not clear it's indefinitely sustainable under current practices. The trustees adopted an alternative scenario from the chief actuary that basically says these kind of gradually ease over time. If that happens, we have a dramatically larger funding gap, about more than twice as large over 75 years and more like 5 times as large by the end of the 75-year period. Next slide, please. Of course, Medicare Part A is the part that's in this sort of dedicated trust fund with revenue, but all parts of Medicare matter for the federal budget, and the trustees see that all of them are rising rapidly. Again, driven mainly by demographics under current law, but under this alternate scenario, also driven by rising healthcare costs to a very significant degree. You can see Part A, Part B, and Part D all have rising costs. Next slide, please. Medicare Advantage, I should mention, is an increasing share of this. So even though we're continuing to divide by Part A, Part B, and Part D, a lot of people are buying a single plan that covers all of it. In fact, in only a few years, half of enrollees are going to be in Medicare Advantage relative to traditional Medicare or ACOs. Next slide, please. The outlook for both Social Security and Medicare, as I mentioned, has improved relative to last year. A lot of puts and takes in either direction, including much lower take-up in disability. I think we believe in part because ordinarily in a recession, people enter the disability, people that are workers with disabilities enter the disability program in larger numbers. This time around, they instead entered the very generous unemployment benefits and now are re-entering a very hot labor market. And so we're not seeing the same kind of disability enrollment as we usually would. In addition, the economics are improved from a trust fund perspective with a stronger employment recovery and GDP recovery. But if you look at the next slide, I have to say that it's not clear those reflect the current economic situation. The trustees' numbers were locked in apparently in February. Their growth assumptions appear too strong in the near term and the long term. Their interest rates appear too high, which is not related to when they locked it. And their inflation numbers are far too low. For example, they're projecting a 3.8% COLA for this coming year. We did the math on this. In order for there to be 3.8% COLA, there'd have to actually be 6% annualized deflation for the rest of the year. That's obviously not going to happen. Even if there's no more inflation for the rest of the year, there's going to be a 6% COLA. At our current trend, it's going to be 9.5. It's probably going to be somewhere between those two, somewhere between 6 and 9.5. It's not going to be 3.8. So the trustees' economic projections are out of date. And in fact, I think if you just did nothing else but update that COLA, we may be back at that same 2034 insolvency for Social Security as opposed to the 2035. Next slide. So I encourage you all to visit our website. We have a couple papers that we put up on these trustees reports. We also have these nifty countdown clocks that give you a lot of anxiety when you look at them because you realize just how little time we have. But at this point, I'd love to turn this over to my colleague, Josh Gordon, and a panel of experts that's going to really dig through a lot of these issues in more detail. So thank you all.
Okay, thank you all very much for coming. The panelists will join us here with their cameras on. Let me introduce myself. My name is Josh Gordon. I'm the Director of Health Policy here at the Committee for Responsible Federal Budget. I also help run our Trust Fund Solutions Initiative. I'm going to introduce our panelists and give them each a chance to speak about either the Social Security or Medicare Trust Fund and Trustees Report, and then we'll have a group discussion and answer audience questions. So don't forget to send those in using Zoom's Q&A feature. We are going to start and hear from Chuck Blahous, who is the J. Fish and Lillian F. Smith Chair and Senior Research Strategist at the Mercatus Center at George Mason University. He was also a public trustee for Social Security and Medicare from 2010 through 2015. Chuck, why don't you get us started?
All right, thank you very much. I think the first thing I need to make sure I can do is successfully share my screen. So perhaps you can all let me know when I've succeeded in doing that. Can you see my presentation now? All right.
We can see it now, Chuck.
All right, good. Thank you. All right. Well, I'll try to be succinct. I've done what I usually do, which is to prepare more material that can be fit into the allotted time. But I thought it would be good to step back at first and just remind ourselves why we care about these reports. Social Security is not your typical federal program. It is financed in a very specific way. Specifically, it's financed via two trust funds, one for old age benefits, what people think of retirement benefits as retirement benefits, and one for disability benefits. And the basic idea is that these are contributory insurance programs. They are programs that are funded by payroll tax contributions made by workers. They aren't funded from the general budget. They aren't mixed in with the general budget. The vast majority of the funding comes from the payroll tax contributions. A little bit comes in from the income taxation of benefits, a little bit from interest credits based on previous surpluses. But the basic idea is that, with very few exceptions, the idea is that workers are paying for their own benefits. And that gives taxpayers the assurance that the program's benefits are not uncontrolled, that the benefits are limited to the amounts that workers' prior contributions can finance. And what it provides to workers is a high degree of political protection for those benefits, security and reliability in those benefits because of the representation that they were earned, that they paid for them. And so lawmakers are strongly inhibited from making any reductions or changes to benefits below the levels that workers' trust fund contributions can finance. And what the trustees reports do for us each year is they illuminate whether going forward, the trust funds will have enough resources to fund the benefits that are currently being scheduled from the program. Now, why do we care? Occasionally you will hear people saying, oh, why do we do this? We don't keep track of whether the Defense Department is running a deficit or whether SSI is running a deficit, et cetera. Why do we do it for Social Security? Well, we do it for Social Security because these reports tell us whether we can continue to have, going forward, the type of Social Security program we have had historically. Again, this is not a program that has to compete for funding within the general federal budget every year. It is a program where workers have very secure and reliable benefits based on the perception that they have earned those benefits with those contributions. Now, with that stability and protection comes a price. That only works if lawmakers are willing to keep system finances in balance. If we are not willing to align the program's benefit obligations and its dedicated tax income, then we can't have this type of system. We would have to abandon the system, subsidize it either in whole or in part from the general government fund, do away with the whole idea that workers have financed their own benefits. And historically, programs that have been constructed that way have been very different in their political fortunes than Social Security. Other programs, they compete for funding each year within the general federal budget. There's a constant reassessment of benefit levels and eligibility rules and means tests and work tests and all sorts of things that Social Security has traditionally escaped. And so what these trustees reports are doing for us is telling us whether going forward we can continue to have Social Security the way it's been constructed to date. And if we want that, what are the sizes of the changes we have to make in either the revenue or benefit streams in order to continue that. Now, this is a version of a graph that Marc has already shown. I just cut and pasted this one directly from the trustees report. But again, this is really all the financial information in the trustees report in a nutshell. Everything here is expressed as a percentage of American workers' earnings. And as you can see, the bold line in this graph shows that costs in the program are rising faster than workers' earnings can keep up with. And that is the essence of our problem. In 2010, we opened up an operating deficit. It costs more money to pay benefits than workers' tax contributions could cover. And that deficit has been widening in recent years as costs continue to grow faster than is sustainable. So what's happening is the program is beginning to draw down its trust funds. And as Marc indicated, it'll draw them down completely by the mid-2030s. And there's a large 20% gap between the benefits that are scheduled at that time and the resources that will be available from incoming tax revenues to pay benefits. Now, again, Marc covered some of this, so I can go through it relatively quickly. But the point is that our choices are becoming very difficult and very constrained, and really reaching the point of untenability already. If we were willing tomorrow to fix the system, and we were to try to do it by raising taxes. Now, of course, that's not going to happen. But if lawmakers were willing to fix the system tomorrow, we would need a tax rate increase of from its current 12.4% up to 15.64%. Or alternatively, if we wanted to do it on the benefit side, and again, Marc did provide these numbers, but you'd have to cut benefits across the board by 20%. Now, again, that's not for prospective benefits. That's all benefits, including everyone who's been collecting benefits for decades. Now, lawmakers haven't done that historically. Lawmakers haven't been willing to cut benefits 20% for the poor 95-year-old widow who's been collecting for 3 decades. Historically, Congress has only been willing to change benefits on a prospective basis. And the size of those changes we'd have to make if we were willing to do them tomorrow would be 24% across the board. Now, again, this really understates the severity of the problem because we're not going to cut benefits 24% tomorrow. If we do have any changes, we're likely to phase them in more gradually, maybe 1 or 2% at first, but then we'd need more severe changes over time. So this dramatizes just how big the problem has already become. And very importantly, again, Marc did cover this, but I think it's worth repeating. By the time the 2030s roll around, it's game over. There's no plausible, realistic scenario in which you can fix system finances if you wait that long. And I think the most compelling point to serve that point is that even if we were to completely cut off all benefit payments for new claimants in that year, you still wouldn't be able to generate enough savings to keep this trust funds from going under. So from a practical standpoint, what matters is not the technical date of depletion of the trust funds. That's really an overemphasized element of the report, because by then, there's no way we could fix system finances. So the question is, how large is the problem? And at what point does it become so large that the problem is insoluble? It doesn't really matter the technical date on which the trust funds become depleted if we've already gotten to the point where we can't maintain the system finances anyway. Now, again, I'm going to go very quickly through this slide. There's too much text on it for this presentation, but I think it's important to address a common myth that is out there. And it is a myth. I don't want to pull my punches by saying that this is anything other than a myth. And the myth is that we have time to deal with this. We can wait until the 2030s to deal with it because the trust funds don't become depleted till then. It might not be pretty. It might be difficult, but we can do what we did in 1983 when lawmakers saved the system from the brink of insolvency at the last minute. It was difficult, but it was doable. That's what we can do again in the future. No, that's not right. In 1983, we had very specific conditions that were specific to that time. They don't exist now, haven't existed for a long time, won't exist in the future. They had a relatively manageable hump they had to get over. There was a difficult problem to deal with. There was a 7% gap between benefits and revenues that was challenging to deal with, but it only lasted a few years. They had to get over that hump. And the baby boomers were about ready to come into the ranks of workers and then build up surpluses after that, even before the 1983 reforms were enacted. So they had a manageable problem to solve. That is not the problem we have now. We have much larger annual shortfalls. They're permanent, they're growing over time. We don't have the same level of commitment today to making the tough choices to keep the system self-financing. So it's just not realistic or practical to expect that we can do the same thing in 2033 that we did in 1983. Just to further depress everybody, I think, I agree with Marc. I think the situation is probably worse than it appears taking a superficial look at the trustees report, because again, Social Security has multiple trust funds. Each one has to be kept in balance separately. The old age fund is actually a little bit worse off than the hypothetical combined trust funds. And there are a number of places in this report where there are assumptions made that I think are clearly too optimistic from a program financing perspective. They're assuming 4.5% inflation in calendar year 2022, going down to about 2% in 2023. Obviously, I think we're going to be well above that, assuming very significant real wage growth this year and next, much higher than historically typical, assuming that a recent downturn in disability incidence is going to remain well below historical averages. But on the other hand, assuming that fertility increases pretty sharply going forward relative to where it has been for the last several decades. And we have to also remember that even though the Disability Insurance Trust Fund is theoretically solvent for 75 years, there's only 8 months worth of assets in that trust fund now. So it doesn't take a very large deviation from the median projection before decades of solvency come off of that disability trust fund. So there's a number of reasons why things are probably worse off than seems to be the case. Just very quickly, obviously there are various categories of fixes we can make to deal with the problem. Changes to eligibility ages, slowing the growth of benefits, some other reforms, how the benefit formula works, more accurate measurement of consumer price index, tax increases, increasing the amount of income subject to the payroll tax or the payroll tax rate. That all sounds very difficult, I know, and it is politically. I will say, and I will try to end on a positive note here, there are win-wins possible in this situation. Usually the typical view is, well, it's all pain and no gain. That's why lawmakers don't want to deal with it. No one wants to raise taxes. No one wants to raise eligibility ages and so forth. But having researched Social Security pretty comprehensively over the last few years, I think it's fair to say that there's a number of reforms we ought to be making to Social Security for their own sake and will save money, whether it's technical reforms to get consumer price index right, or doing away with some accidental, inadvertent, counterproductive, regressive income transfers in the system. There's a lot of ways the system moves money around that people don't really understand and which policymakers didn't initially intend. We fix some of those things. We'll actually have slower cost growth going forward. We'd strengthen program finances. And you'd also improve intergenerational equity under the program. And you would ameliorate income inequality and better target program resources on needy households and improve its efficacy as income insurance. So there are wins here, policy wins to be had. They may not be politically easy, but they would be good policy from a Social Security equity perspective and from a financing perspective. So with that, I'll end on that positive note and just note, yes, these challenges are very severe. We're running out of time to deal with them, but there are good things we can do to reform the system if we're willing to do them. Thanks very much.
All right, thank you, Chuck. Next, we will turn to Kathleen Romeg, who is the Director of Social Security and Disability Policy at the Center on Budget and Policy Priorities.
Hello, thank you so much for having me. I thought I might dig in a little bit into what's kind of going on behind the curtain of the trustees report this year, because as Marc laid out for everyone at the beginning, though the bottom line, the kind of headline number, that reserve depletion date has only changed slightly, there's been a lot going on in this last couple of years in this country, both economically and otherwise. So I thought I'd just dig a little bit more into that now. So starting with the good news of the past year is that many more people are employed now and paying into Social Security in 2021 than in 2022. That is great news for workers, great news for the economy, and really good news for Social Security. As Marc explained, Social Security is mostly a pay-as-you-go program, so current workers pay for current benefits. So the more workers that we have and the more that they're earning, the better it is for Social Security financing. And speaking of wages, wages were also up significantly in 2021. Again, that's good news for everybody. Now we move on to the less great news. One thing is inflation, and as Marc described, it's not fully accounted for in this year's trustees report because the conditions have been changing so rapidly. This affects Social Security's costs in the short term because benefits have an automatic cost of living adjustment. It also, of course, that cost of living adjustment gets baked into the benefit into future years. Social Security's COLA is excellent news for beneficiaries. The value of people's private savings, stuff like IRAs and 401ks, erodes with inflation and is eroding quickly during this time of high inflation. Most private pensions, if people are lucky enough to have them, either aren't adjusted for inflation or just have a partial adjustment for inflation. So Social Security is the only retirement income that keeps up with the cost of living, and that's so valuable to people, older people and people with disabilities living on fixed incomes. So I think we should be grateful, the beneficiaries among us should be grateful for that. This automatic COLA is a legacy of the last time we had major inflation in the US, which was in the 1970s and early 80s, a generation ago. Many of us don't even remember that, but that's where it came from. And so that means that Congress doesn't have to go and make ad hoc adjustments like they did before the 1973 amendments to Social Security. But as Marc described, it does deteriorate as Social Security's financing outlook when you have to pay higher benefits. So that's, it's a trade-off. Another factor that has changed Social Security's financing outlook in the last year or so is that both birth rates and immigration rates were down last year, even compared to what the actuaries were projecting a year ago. Again, because Social Security is mostly a pay-as-you-go program, it's really important that we have plenty of workers working in the economy to pay for benefits. But now it is looking like we are going to have fewer workers than previously expected, even only recently. And then the saddest part of the story of how Social Security's finances have changed over the last year or two is just how many Social Security beneficiaries have died. Older and disabled people, Social Security's primary beneficiary populations, suffer much higher COVID mortality rates than other groups. And the numbers are just heartbreaking. Last year, 2 years ago, in 2020, 400,000 more Social Security beneficiaries died than in 2019. In 2021, when we get the final numbers, it's going to be even higher. More Americans died of COVID overall in 2021 than in 2020. And the Omicron wave killed more older Americans even than Delta did, even though vaccination rates are very high among the elderly population. Tragically, those people who died are no longer receiving their Social Security retirement and disability benefits. So that does reduce Social Security costs, but for just a horrific reason. Now, some of those workers and beneficiaries who died of COVID left behind qualifying family members who are now receiving Social Security survivors benefits. However, there have been access problems. There's been some good reporting on COVID widows and orphans in particular, and how they have struggled to access benefits during a time when with a lot of customer service challenges at the agency, and maybe we can talk more about that. We're also not sure, and the actuaries acknowledge this in the report, of exactly what's going to happen with disability claims, specifically due to long COVID. Social Security disability insurance applications and awards have fallen every single year since 2010, including 2020 and 2021. We don't know yet how long COVID is going to affect disability applications and ultimate awards, and we're not going to know in the near term. I don't think it's going to sort itself out. Lower SSDI enrollment, of course, does lower Social Security's cost, and that's part of the reason that SSDI's trust fund is looking better. But that's bad news if it means that people who are eligible for benefits aren't receiving them. The trustees, because of this downward trend in disability benefits, not only changed their recent data and their near-term assumptions about the number of people who will receive disability benefits, but also adjusted their long-term assumption in this year's report. And so that's the main reason that the disability trust fund outlook is so much better than last last year's. And of course, as Chuck also mentioned, the trust fund is in close balance, so small differences can make a big difference in the long-term outlook, at least in that number. It is a first since 1983 that the Disability Trust Fund is expected to be solvent throughout the entire 75-year projection period. So that's really good news. But this year's trustees report also tells us that we're going to need to adjust Social Security financing overall soon, certainly before the program's reserves are depleted in about 13 years. Thank you.
Thank you, Kathleen. Next, we'll hear from Jeannie Fuglesten Biniek, who is a senior policy analyst for the program on Medicare policy at the Kaiser Family Foundation.
So there are 3 points that I want to focus on today. First is that while the specific date for solvency for the Hospital Insurance Trust Fund has moved out slightly, which is good news, Medicare still faces, pretty significant spending and financing challenges, and that's in part due to the underlying demographic factors, largely due to that. Second, that the role of private plans in Medicare is going to continue to grow, and this is important to note. And third, that it will likely take a combination of policies, including new revenues, to address the shortfall. So first, jumping into Medicare spending and financing challenges. So while the specific date of solvency has been extended, I wanted to note that over the last 5 trustees reports, the insolvency date has been within 10 years. And if we look back to 2000, that has only happened one other time. So this is a real acute challenge that we're facing. And one of the largest driving factors is the demographic changes. We're still in the midst of a shift where we have more beneficiaries coming onto the program. And this means that we've seen a reduction in the number of workers currently paying into the trust fund. So going back to 2000, it was about 4 workers per HI beneficiary. In 2020, it was just under 3, and that number is going to continue to slowly decline. When we look at the role of private plans, as Marc noted earlier, if you look as a share of Part A beneficiaries, Medicare Advantage enrollment will surpass 50% in 2026. If you look at those enrolled in Part A and Part B, which generally you have to be enrolled in both in order to be eligible for Medicare Advantage, the trustees actually state that we've exceeded 50% this year. And corresponding to that increase in enrollment is an increasing share of spending on Medicare Advantage. So looking at how Medicare Advantage spending is going to change, through 2021, there's a little more than an additional $500 billion in spending on Medicare Advantage. Once you remove inflation from that, about half of that is due to growth in enrollment in Medicare Advantage, and about half is due to growth in spending per enrollee. And while spending per beneficiary is projected to grow in traditional Medicare as well, it is projected to grow faster in Medicare Advantage. And part of that is that the spending on extra benefits is projected to grow faster than spending on Medicare covered services. So these are things like dental, vision, hearing, fitness, and a number of other benefits. Things that while beneficiaries find them to be valuable, they are not available to traditional Medicare beneficiaries. And there is also just a lack of transparency as to what these benefits are, who uses them, how much they actually cost. They're something that they have increased substantially over the last couple of years and will continue to be a larger part of that payment that we're making to Medicare Advantage plans. Moving into sort of solutions, if we stick with Medicare spending for Medicare Advantage, here are 2 illustrative paths by which Medicare payments per person could be reduced. So on the left, if payments were 2% lower each year, that would be $125 billion in savings through 2031. If payments for Medicare Advantage enrollees grew at the same rate as traditional Medicare, savings would be about twice as high. But one thing to note is in both cases, the savings that would actually accrue to the trust fund is less than half. And it actually decreases over time. So in 2022, it's a little more than 40% of the savings will go to the trust fund because Part A spending is 42% in 2022. By 2031, that drops to 38%. So if you just take the last year, the biggest orange bar here, it's almost $54 billion of savings. Only 20 billion of that would go to the trust fund. And so even this seems, I would say, aggressive. And I think just underscores the fact that we're going to need to look in many places, and we're going to need to probably include new revenues if we're going to actually meet that shortfall. At the same time, we need to remember that the financial burden of healthcare for people on Medicare is high. On average, about a third of Medicare beneficiaries spend 20% of their total income on healthcare expenses. That share is much higher for people who are in worse health, people who have lower incomes, and people who are older. And this is one of the reasons I think that many of the recent discussions around Medicare have not focused on solvency or even sustainability of the financing or spending in Medicare, but have instead focused on how to address gaps that exist in the current program. Those policies, however, would mean more spending. So improving affordability by adding an out-of-pocket cap to either Part A and Part B or to Part D, strengthening protections for low-income beneficiaries, enhancing benefits by adding dental, vision, hearing, or long-term care to the benefit, and maybe to a lesser extent, but still something that's been proposed, is expanding eligibility by lowering the eligibility age. So I think this just underscores on balance how difficult it is and how many different things we have to keep in mind and balance at the same time. And I'll just close by some of the resources that we have on our website that will hopefully be useful for people. Thank you.
Thank you. Okay, and finally, we will turn to Brian Miller, who is a practicing hospitalist and an assistant professor of medicine and business at Johns Hopkins and a non-resident fellow at AEI. Brian?
Thank you. Let me share my screen here. Okay, so first of all, thank you all for organizing this. As you can see, this was sort of my thought when we first were thinking about what to do about Medicare and fiscal challenges. My colleagues summed it up pretty well. And I think that this is relatively all of our response. This is a huge problem. And as I saw one of the questions in the audience point out, it's actually been a problem for a very long time. And I found this nice New York Times article back from 1990 predicting insolvency. And this graph going back many decades, apologies for it being small, showing the years predicted for the Medicare Hospital Insurance Fund solvency. So the question is, of course, why hasn't this come to bear? And the answer is Congress has historically responded by deploying various fiscal and policy levers. We've added risk to the original fee-for-service program by adding episode bundles and risk corridors. We've played with sort of revenue by increasing payroll taxes, adding a surcharge for high earners. Unaddressed remain, though, lots of things. For example, demographic pressures. Our fertility rate is quite low. If you actually look at the report, the high cost showed a fertility rate of 1.69, and then the intermediate case showed a 1.99 fertility rate. So that overall puts us on an expensive path, as the number of Medicare beneficiaries as a percentage of the population is going to increase unless we change the population distribution. One of the levers which we have, which is politically fraught, of course, is immigration policy to increase legal immigration. And as the grandchildren of immigrants, I'm obviously a fan of that. The other thing that really remains unaddressed is that Medicare of 2022 is really different from the Medicare of 1965. We didn't really add an eligibility inflator to the age. In 1965, Medicare beneficiaries lived to 70, 71 years of age and dwelled for 6 years in the program. Today, they dwell for 15 or more years. And in fact, Medicare has two programs, as my colleague has mentioned, the fee-for-service program and the Medicare Advantage program. And so overall, we're left with sort of two overarching challenges. One is the increasing per beneficiary spending challenge. And then, of course, as this report highlights, the total fiscal spending challenge. And then, as Marc mentioned, there's sort of an opportunity cost. For every dollar that we spend on healthcare is a dollar that we are not spending elsewhere, as other parts like Part B and D are funded by a general revenue. So sort of my takeaways, as one of my other colleagues mentioned, COVID-19 was terrible. I mean, absolutely terrible. I was a hospitalist and I spent and still am a hospitalist, and I spent 2 years on the front line caring for COVID patients. And I did see anecdotally what the trustees report mentioned, which is that expensive beneficiaries, those with more comorbidities, were likely to pass away from COVID, driving lower expenditures going forwards. The other thing I think that this report highlighted is that our efforts have sort of failed, right? If you go back to that 1990 article, that was the beginning of sort of that discussion of health reform in the delivery system. We haven't really been successful. I think patients and clinicians can attest that most delivery system reforms we have implemented haven't really moved the needle for either stakeholder. We have price controls and traditional fee for service that really hasn't controlled expenditure growth. We know that cost is a function of the price of service, the volume of service, and the intensity of service. And there was a 1998 study on intensity of care and induced demand from the Office of the Actuary. And then, of course, unfortunately, CMMI, with great promise, hasn't really bent the cost curve. So this gets us to wondering, like, why is the Medicare program so expensive? And it's not just that healthcare is expensive, it's sort of an issue of insurance design. And so, I made this little table as I was thinking about this the other day. Medicare is a program of programs, as I mentioned. You can choose between MA, and most is a MA PD plan or a Medicare Advantage prescription drug plan, where you can get traditional A plus B fee for service, plus a prescription drug plan, plus usually some sort of supplemental coverage, could be a Medigap plan or employee retiree coverage. And as you can see, the features of this are sort of different. So the essential trade-off that beneficiaries are making is they're getting supplemental benefits, they're getting a annual cap on catastrophic out-of-pocket expenditures in MA, and they're getting those in exchange for narrower network and utilization controls. And again, I can say as a patient and as a physician, I've been subject to utilization controls, and they're not always fun. And I'm not a Medicare beneficiary, as you can tell, but they do serve a purpose. And so when we think about what Medicare Advantage versus fee-for-service is, you're essentially saying a managed care environment or a 1965 style insurance plan. We know from MedPAC's latest report that Medicare Advantage in providing A plus B services is 88% of fee-for-service expenditures, but the program overall ends up being 2 to 4% more expensive due to supplemental benefits and stars and other program features. I think the thing that is appealing for us as we talk about solvency is that MA is appealing because despite many flaws in the program, plans are paid in a form of risk-adjusted capitation. Risk-adjusted capitation creates a framework for budgeting. And I think most importantly, what all of us here recognize is that MA creates distance between the political class and industry stakeholders, be it pharmaceutical companies, the device industry, organized medicine, hospitals, et cetera, who traditionally lobby whenever we try and decrease fee-for-service payment rates. And so thinking about sort of our policy options overall for the Medicare program, we can increase revenue. That is generally unpopular. Occasionally, members have proposed various ways to increase revenue through eliminating loopholes or increasing payroll taxes. Historically, I will say that that is a great way for members not to get reelected next term, which is traditionally why those proposals have not gone very far. And of course, then you get into what is the alternative. The alternative is cutting expenditures. Cutting expenditures is also unpopular if there is political accountability, right? You can think about it, oh, I want to, better control Medicare expenditures. We're going to cut physician services by 3% and hospitals by 2% this year, in addition to upsetting, of course, industry stakeholders. No one wants to, cut healthcare for grandma or grandpa. And we all have relatives who are Medicare beneficiaries, and we hear about it. The other sort of broad category is what I would call the other bucket. Those include budget gimmicks, so transferring services from one part of Medicare to the other to change projections. We can have social policy to promote increased birth rate in the US. Of course, you also have to be careful that those don't incur costs themselves, such as the child tax credit. You can increase legal immigration, which increases the base of workers paying into the program. And then, of course, there's Medicare programmatic reform. And so I mentioned sort of MA in that last bucket because it allows and moves political accountability out of the political class and moves it on a third party. So one thing we could think about doing is transforming CMS from a plan operator into a market regulator, right? So the fee-for-service program is losing its programmatic market share in response to MA. So that presents us an opportunity to make CMS into a strong market regulator. Risk-adjusted capitation in MA, while imperfect, presents the beginning of a meaningful budgetary framework. And then through that, we could reform MA by implementing competitive bidding, creating an appropriate pragmatic comparison of MA versus fee-for-service. And then, of course, driving beneficiaries into MA instead of driving them into fee-for-service, which, while fee-for-service itself is less expensive than MA, fee-for-service plus, say, supplemental coverage plus a prescription drug plan is not necessarily cheaper than an MAPD plan. Thank you.
All right, thank you, Brian. All right, we'll have all the panelists come back to us with their cameras on, and I will ask some questions. I'll kind of mix in discussion questions with audience questions to the best of my ability. I think the first question I always like to ask, because this is the thrust of our Trust Fund Solutions initiative, is that we like to think of solutions for solvency that also improve these programs. I think Chuck might have referred to this as a win-win. I'm not sure in the political frame any of it is a win-win, because it's always hard to get politicians to divert from the status quo. But I want each of you to give me kind of the one thing off the top of your head that you think we could change that would both improve trust fund solvency and also improve the specific program that you've been talking about. And it can't say you want all new politicians. So what is the kind of policy change that you would choose that has this kind of win-win potential? Why don't we do it in the order that everyone talked? We'll start with Chuck.
Wow, it's hard to pick one. I mean, if I can bifurcate my answer a little bit, I think the most obviously responsive to the situation that we're in, and the one that I think is probably truly a win-win from a policy perspective, but certainly not perceived as one politically, is to change eligibility ages. That is not only, it's a combined revenue and outlay reform. It's also something that improves income security in retirement at the same time as it improves program finances, because the greatest risk of poverty in retirement arises from leaving the workforce too early. Even a change of a few months in one's departure from the workforce can do as much for your income security in retirement as saving an extra % of your pay your entire career. So that's an enormously beneficial thing to do. I will say I have a pet reform I would love to see made that is much smaller financially, but I think we got to change the structure of the benefit formula, which currently now is a function of your average earnings over your lifetime. We ought to change how it works so that it operates on every individual year of earnings, sort of the way a private pension plan operates. Each year you work, you earn a benefit that's equal to X% of your earnings in that year. We should do that for two reasons. One is that the current system causes return on work to drop through the floorboards after you hit the magic number of 35 years. And to maintain rewards for seniors who continue to work, stay in the workforce, they ought to be able to continue to reap the benefits of that by changing how the benefit formula works. At the same time, we save money because there is a problem with the current system where it mistakes sporadic high-income earners for low-income people because it's only looking at the average earnings over the lifetime. And so you have these folks who are getting windfall returns from the system, even though they're actually in high-income households, but they're sort of flitting in and out of the workforce and earning a lot of money during the brief years that they're in. So by pulling back on some of those unintended regressive income redistributions, we can improve work incentives and program finances at the same time.
Kathleen?
Sure. Well, maybe I can discuss Chuck's answer a little bit more later, but my answer is I think we should do it primarily on the revenue side, and there are good reasons for doing it that way. First and foremost is that when you ask workers and beneficiaries, how would you like to fix Social Security's financing problems? People overwhelmingly answer that they would rather pay more than have their benefits cut. And that's true among Democrats, it's true among Republicans, it's true among old people, young people. That is how people would prefer to do it. And as Marc laid out at the beginning of the presentation, the long-term solvency gap for Social Security is about 3.5% of payroll. And that's a manageable amount of money. There are plenty of options on the revenue side, plenty of things that have changed since 1983, the last time that we addressed Social Security financing, like significant increase in wage inequality, for example, or significant amount of compensation that's not delivered through wages anymore, and ways that we can update the system, update the revenues that go into Social Security to account for these major changes that have happened in the last generation. And we can just ask workers to pay a little bit more each paycheck so that they can be given the benefits that they've been promised.
Jeannie?
So I won't endorse a particular policy, but I'll just generally speak about an area that I think has opportunity, which is how we pay Medicare Advantage plans, looking at how we set the benchmarks, what the role of the quality bonus program is, and then also what we expect of Medicare Advantage plans in terms of the data and information they provide back about what they are, how they're functioning. So complete encounter data, data on the extra benefits that people are actually using, and then also appeals and denials. And some of this information is available, but it's just incredibly difficult for people to really understand and make informed choices or to consider when making a decision. And so I think there's opportunity there. And then last, revenue and spending, I mean, we're going to have some combination. So there's definitely just not one solution.
All right, Brian?
Be a man of few words. I agree that Medicare Advantage plans benchmark policy needs to be addressed. So I'd say my number one solution would be implementing competitive bidding for the Medicare program, because I think that we want all plans to compete, MA plans and fee-for-service included.
All right, maybe we'll get into a little bit of the technical stuff about that in a little bit. I want to, the most common thing that I'm seeing in audience questions, and we'll have Chuck and Kathleen discuss this, is you have, as Kathleen said, this sort of public expression of desire to eliminate the cap or bring in new revenue into the system. And you also have this idea that there's, well, not idea, there are statistics about increasing income inequality in the country. So can the two of you talk about this kind of dual discussion and talk about eliminating the cap, increasing revenues, and retirement age sort of as this combined emblematic dual policy proposal and how it impacts, how income inequality impacts how you think about those proposals.
Shall I go first, or does Kathleen want to go first?
Kathleen, why don't you go first?
Ooh, sorry, what's that? Do you see me?
Kathleen can go first.
So yeah, just so that people understand, the Social Security payroll tax is a flat tax. It's 12.4%, levied evenly on employers and employees, 6.2% each, and a full 12.4 on self-employed workers. But that's only up into a cap. And so this year's cap is $147,000 of wages. And what that means is, say you make up $200,000, you only pay Social Security taxes for the first 9 months of the year, and then you stop paying for the remainder. Now, this is important because it's people who make more than $150,000 or so a year often make a lot more than that amount. And so that, those wages are not tapped to pay for Social Security. Medicare once did have a tax cap in its payroll tax. It no longer does. There's no cap whatsoever. So one proposal out there is what proponents nicknamed scrap the cap, just get rid of the cap altogether, have it go all the way up to your last dollar of earnings. And that would close a whole lot of the Social Security financing gap if you did it that way. Now, so that would be sort of the maximalist position, tax every single dollar of wages, and then you would have to decide, because Social Security benefits are based on lifetime earnings, how much of those additional earnings do you put into the benefit formula, if any? Like the most maximalist position would not to give any return on those. If you did that, that would solve by itself, the most maximalist, and I'm not recommending that. I've just pulled up the numbers here. That would solve, the majority of the long-term solvency problem. Now, there are much more I get smaller ways to do this. So the last time policymakers set this cap, which is indexed to average wages every year, it covered 90% of aggregate wages in the economy. So if you set the cap again to cover 90% of aggregate wages in the economy, and instead of increasing it with average wages, increase it so that it kept up with that benchmark of 90%, you would also close a decent chunk of the gap. I think, I'm sorry, I just had the numbers up, but yeah, so if you did that without providing additional benefit credit, that would cover about 1/3 of the financing shortfall. I'm sorry, 1/4 of the financing shortfall over the next 75 years. So there are different ways of doing this. And I certainly think that, in order to account for the really dramatically increasing income inequality in this country, a lot of it is income that's not wage income, but there's also some significantly growing wage inequality in this country. It does make sense to take another look at those rules and to make sure that higher income workers are paying their fair share, and you'd have to work out some of the details, but I think that should absolutely be part of the ultimate package.
Shall I go next? Let me just say, I agree with Kathleen that raising the cap on taxable wages consistently polls better than almost every other option that is discussed. For that reason alone, I think it's very likely to be part of a solution. It's funny, I saw some of the questions saying that I hadn't mentioned it in my remarks. I actually did mention it in my remarks. Maybe I spoke too quickly and too hastily, but I did list it among the things that needed to be considered. Because of that, I think, I talk about policy considerations, but I also recognize the political realities. And I think, even though I personally, for a number of policy reasons, think most of this ought to be done on the cost containment side, certainly a solution that we're roughly 50-50 with respect to taxes and benefits strikes me as a reasonable way for legislators to approach a compromise solution. And if you did that, you would probably wind up leaning pretty heavily on a tax cap increase to deal with the side that was the revenue side. Now, let me issue some caveats about that. One is that, it doesn't really accomplish as much as first appears from a financial perspective, because in Social Security, it's not like Medicare. In Social Security, your benefits are a function of your income that has been subjected to tax. So yes, you get additional revenue up front, you get an apparent improvement in the actuarial balance, but then you wind up owing additional benefits later on, and the financial improvement in the out years isn't really that great. So you wind up buying some time, but not a whole lot of net progress. Now, again, as Kathleen said, you can take some steps to ameliorate that. One, the very severe one, which I wouldn't recommend, is to sever that connection between contributions and benefits, so that you're basically, for the first time, taxing people, taxing their earnings, but not crediting them towards benefits. And I think that's a slippery slope we shouldn't go down with Social Security. But what you could do is you can ameliorate you can make the financial improvement somewhat better by combining a tax cap increase with a reduction in the benefit accrual rate on the higher end. And that, I think, is a reasonable way to approach the problem. And again, it gets me back to the reality that it's very difficult to do this, even a tax cap increase, without at the same time talking about the benefit changes you have to make. Because if you just increase the tax cap without some type of change on the top accrual rate, you're going to push off the problem, play for time, but you're not going to really make much headway in terms of improving the structural problem. Final point, income inequality. This is actually one of the reasons I lean heavily on the cost containment side rather than the revenue side. A couple of things are going on in Social Security. One is that the program has very different treatment of people depending on when they were born. And it treats earlier generations better. It treats later generations much worse. To the extent you load up the solution on the tax side, you are worsening the net treatment of younger workers who are already getting the worst treatment, and you're letting off the older generations who are getting comparatively better treatment under the system. So you worsen the intergenerational inequities and inequalities in the system if you rely on the tax side exclusively. Secondly, we've had a lot of increase in income inequality in this country in the last several years. It has not been equal by age. It's been much greater income growth in the older groups than among younger groups. The people who have benefited the most from rising income inequality in the last several years are much, much more likely to be beneficiaries over the next 20 years than they are to be tax-paying workers. So you cannot really get at the people who have benefited the most from income inequality with a solution that focuses on the tax side. That shifts the burden to the next generation of workers coming up who may or may not have been on the winning end of that lottery. So you really can't avoid, if you're trying to maximize the progressivity of a solution, I find it very difficult to do it without dealing with the rate of growth of benefits on the high income end.
All right, thanks. Okay, so for Medicare, the one thing that always is interesting to read in this trustees report is that the trustees give you their projection for Medicare's growth in the future. And their official projections actually have it growing to about 2040 and then sort of plateauing. But then they have what they call alternative projections, where they project more kind of steady growth throughout the period. And I think we would consider that a more realistic scenario given how healthcare has grown in the past. So let me start with Brian on this. They say that they need to have this alternative scenario because they feel like under current law, payments for hospitals and doctors would grow so slowly that it would be impossible for the healthcare system to deal with it, and that they would stop seeing Medicare patients. And so they have their illustrative scenario, which assumes that those costs kind of grow more in line with overall growth of costs and sort of wages in the whole country. Brian, you work in a hospital. Tell me, do you even think their illustrative scenario makes sense in terms of continuing the way we're going with business? I mean, at some point, costs have to grow more slowly, right? They can't just keep growing faster than the economy. But their projection that has them sort of plateauing as a share of the economy, they think is untenable and would not be possible for our kind of healthcare system to continue in business, basically. So how do you think about that?
I have a couple thoughts. First of all, I don't think doctors or hospitals are about to leave the Medicare program with rates cut. The discussion happens every year around the payment discussion with the physician fee schedule, for example. It's, no one's going to stop doing cardiac surgery if you cut rates 2 or 3%. But let's take that off the table for starters. Even a slightly higher rate cut than that, you might see a slight decline in participation, but not significantly. So there's that. Then looking back to the 70s, where we said, healthcare spending for GDP is never going to hit 8%. right? Like and then, this woe is us, the end of the world. And, now we've blown way by that. So I do think actually we can keep growing aggressively. That being said, the hospital industry and the hospital business is not a, shall we say, growing business in and of itself as a segment of care, as care leaves hospitals and goes into the ambulatory surgery setting, the outpatient setting, and assuming we get some sort of permanent fix to telemedicine after the public health emergency, which we will eventually, will be remote and back in your own home. So I think a lot of care will traditionally, or what that has traditionally been done in hospitals, is transitioning to ambulatory, and ambulatory is transitioning to home or even self-service. So yes, I do think that there's a reason to think that hospital spending might not actually grow as fast as we think it will. That being said, the total programmatic costs growing are a huge problem, because there's the opportunity cost, where every dollar that we spend on healthcare is a dollar that we are not spending elsewhere. It's not that we don't care about patients, or we don't care about the elderly or the vulnerable or the disabled, but that we as a society have to make priorities and make conscious choices and say, okay, if we're spending more on Medicare, we are spending less on roads to some degree, because you can increase taxes, but you can only increase taxes so much. And it's hard to do it politically.
Jeannie, do you have any thoughts?
One thing to point out is that Medicare has grown more slowly in spending per beneficiary than private insurance. And so a lot of the cost growth problem is for people with commercial insurance and under age 65. And a lot of our Medicare problem is because of the demographic changes and just the sheer number of people. And so while everything is obviously related, it is slightly different depending on which market you're talking about. But I don't disagree that people aren't going to stop taking Medicare. And I don't know that costs are going to grow so terribly fast as I think. I think the demographic problem is really what's driving our challenges in the future.
And I think that's the unique thing. Both of these programs the first order problem is that we simply have an aging population and less workers in the workforce paying taxes to support that aging of the population. So, this may be a question for all of you. When we think about ways to get out of this going forward, I feel like there's not as much talk on the Hill as there used to be about comprehensive solutions. Like, there used to be members who would work together to have their Social Security proposal, and maybe in a given Congress there would be 2 or 3 Social Security proposals, and you don't really see that. I know that right now there's one Social Security proposal from Representative Larson that we can talk about, but there's also this proposal for a trust act where you wouldn't solve these problems directly, but you would appoint bipartisan commissions on each of these trust funds to come up with solutions that would then have to be bipartisan in order to get enacted, as a way to kind of speed up the process towards solutions. So do you guys have thoughts on this trust act and the general lack of plans to comprehensively fix these trust fund problems? Anyone can just jump in.
I'm happy to jump in. I'm not sure how much more useful my thoughts are than anybody else's, but I agree with your observation. I think there has been a decline in seriousness and bipartisanship. What else is new, right, on this issue as in many others? When I was working on Social Security on Capitol Hill in the 90s, there were a lot of proposals that were put together that had both Democratic and Republican sponsors, and they had mixes of a lot of different elements. Tax changes, benefit changes, eligibility age changes, investment changes, all sorts of things. So I think there has been too little of that. There's been too little bipartisan cooperation in general. I think there has been a retreat from fiscal seriousness across the board, and certainly the retreat from fiscal seriousness on entitlement programs is both a symptom and a cause of that. Having said that, I choose to be an optimist. I do think there are serious people on both sides of the aisle who, in a better environment, might be willing to work together. I know there's always work ongoing on the Hill to explore possible avenues for solutions, and I hope they bear some fruit. On the Trust Act, I'll just say I give an A for effort and good intentions, but I'm very skeptical as to the potential benefits of it. I just published a study a few months ago about various efforts to create meaningful financing reforms in federal budget policy. And my unfortunate conclusion is that process reforms just don't tend to work. We want to think up, better processes that will somehow get people to do the right thing. But I find that it just, we've had a lot of efforts at creating special processes, special tracks to get reforms done. And they don't seem to lead anywhere because we still have the same fundamental divide over how to approach these problems.
Yeah,
No, you can go ahead.
I strongly agree with Chuck on that. I don't think process reforms are what we need right now. And I would also point out, it's not just a lack of bipartisanship. It's also that Republicans haven't put forward any serious ideas about Social Security in recent memory. I mean, really, at the very least, since President Trump during the campaign said that he promised not to touch Social Security. I mean, Republicans have been silent on Social Security financing since then. There's nothing stopping Senator Romney or any of these other senators who want to force their colleagues to talk about Social Security right now. What do they want to do? Go ahead, write a bill, have a press conference, use the power of their office now to propose what they want to do. On the other hand, when you look at the last presidential cycle, the Democratic candidates did put forward proposals to improve Social Security's financing. It might not be, what to everyone's liking. Same thing in Congress. There is, the Larson bill in the last Congress would have created sustainable solvency for Social Security. Almost every Democrat signed on to that version, and then this new version that, CRFB has explained very clearly is very different from the last version, but that version would have created sustainable solvency for Social Security. Democrats have put forward solutions for Social Security. We've heard nothing from Republicans, and changing the process is not going to give people a backbone.
Jeannie?
Yeah, I was just going to say, when I worked on the Hill, there was the Gang of Six, there was the Fiscal Commission, there was the Super Committee. There were, and maybe because I was in the midst of it, very serious people talking seriously to, staff and to members on the other side. And we still didn't come out with any solutions that actually we were able to implement and were able to pass. And so I don't know that, looking to some heyday of bipartisan cooperation really is, I think we're maybe fooling ourselves that that's something that it existed anytime relatively recently. Even when people were trying to do this in a serious bipartisan way, we couldn't get it done. And so I think we need to be, maybe a little bit more realistic about what's holding us back. It's not that there's a lack of bipartisan efforts. It's that these programs are really popular and they provide really important benefits for people, and making changes to that is really hard to do.
I have to disagree a little bit. I do think making changes is hard, but I do think that there has been a lack of bipartisanship, and I think we sort of have to take the temperature down from, say, a full broil charring the burgers to maybe like 300 degrees and cook some fish. So, and sort of like go back to the sort of, I guess, coffee, lunch, martini, whatever it is, where people get together and start to come up with solutions as a group, and we all get a bit of heartburn in doing so. And that's how I think we get stuff done. That's how we passed the Balanced Budget Act. And that's, of course, where Medicare Part D came from. And, all these sort of large programmatic changes have been bipartisan. They historically have not been one party or the other. And when we have done that, it has created a lot of bad blood. So I think actually working together is the way to get stuff done in a sustainable fashion going forwards. And apologies for being long-winded. I think we also need to be smart about our goals rather than going for massive, here's our 10-point overhaul for whatever the program is. I think we need to have what one of my friends calls aggressive incrementalism. So every couple of years, we need to get some milestone and some part of the program changed to modernize and update it and give it continued legislative attention over time, sort of like a cat. And I think that that is the way to get some stuff done.
Could I leap in? I am sorry for a second bite at the apple, but I just wanted to respond to a couple of things that Kathleen had said. My own view is that there has been, and I certainly agree that certainly since the Trump administration came in, there's been a great retreat from fiscal responsibility. My own view is that it's been a bipartisan one. I felt a pang, a flinch when it was framed as, oh, look at Democrats coming forward with all these Social Security proposals. Why aren't Republicans coming forward with anything? You remember, these Democratic proposals are not proposals to really solve the problem. They're proposals that would actually increase the cost problem relative to what we currently have. I don't tend to see them as serious proposals. They're much more political statements. To me, that would be like Republicans coming forward with proposals to cut the payroll tax very dramatically and then saying, oh, we're also cut benefits so much to keep system finances in balance. And what's the problem with that? Isn't that a good starting point for the discussion? I think there's a fundamental unseriousness in saying, in an environment where we have to figure out how to, how much we're going to raise in revenues, how much we're going to slow the growth of costs, but for one side to come out and saying, okay, our opening bid is to actually, really dramatically increase the cost problem. You got to negotiate with us just to get back to the starting point. I don't think is a reasonable starting point for discussion. I don't think it should be understood as one. And I think it's obviously been done as a political gambit, not as a serious opening bid in a financial solvency discussion.
I actually want to say that at least in healthcare over the last decade or so, even though things were very partisan on the surface about the ACA and whatnot, there was some kind of bipartisan agreement that cost control, certainly in Medicare, might really lean on changing the incentives in Medicare, the payment system, to reward value instead of volume, and to have a bunch of experiments that, Brian talked a little bit about the Innovation Center in Medicare that would try and figure out how to change traditional Medicare to save money and have, as effective or more effective care. But it seems like now that Medicare Advantage is half of Medicare, all of the last decade of sort of agreement has kind of shifted, or at least missed the boat, because while we've been talking about value to volume in Medicare, this whole new Medicare system has kind of arisen and will be kind of the giant in Medicare going forward. So Jeannie and Brian, maybe real quickly, just talk about the general discussion of, Medicare reform, given that we now have really two equal systems that have kind of very different, solutions, and one had bipartisan agreement, and it seems like Medicare Advantage is now a little bit untouchable from both parties in a way that I don't really think cost control was over the last decade. But maybe I'm reading that wrong. What do you think, Jeannie?
Well, at some point, nothing is untouchable because there will be healthcare services delivered and providers will expect to get paid for them. And so I think we will have to figure something out. I do agree that there's not an appetite for really doing anything aggressive to reduce payments, and not even aggressive, maybe anything hardly at all to reduce payments for Medicare Advantage. And that is bipartisan. So, again, this idea that bipartisanship will solve everything, we've had bipartisanship and still not gotten to the solution. I do think we need to look at Medicare Advantage more seriously. It's over 50% of enrollment, it's over 50% of spending, and we really don't know what's going on under the hood in a lot of cases in terms of what services are people using, how often are they being denied care, are their appeals successful, what are the extra benefits, are they using them, how much do they cost, are they providing the value for what we're paying for them. And so I think getting a better handle on all of that would also be helpful in informing how we can make the program work better for beneficiaries. But with the lack of that data and that understanding, I think it is a little bit difficult to figure out what the particular policies and reforms are that will be successful.
So a couple thoughts. We have some of that data. It's just not very easy to manage or crunch or always the most accessible. I think part of the issue is that we haven't, so Medicare Advantage has been around, right, for decades, and it sort of grew in its predecessor forms. And now, here it is today. And in some markets, it's the super majority actually a beneficiary. In some counties, you go down to Florida or elsewhere. And there are varying plan designs, right? There are HMOs, there are PPOs, et cetera. And we don't actually, even before the look at what's going under the hood, we can't actually do the math to compare programmatic spending, which is sort of embarrassing. My second grade teacher would be scolding us right now, right? If we think about comparing A plus B to A plus B plus D plus supplemental coverage, which is functionally what an MAPD plan is. So we're not even making the right comparison. So I'd say even before the data transparency, we need to figure out what are the appropriate series of comparisons between the program. And then I do think you're right. I think we need to have some Medicare Advantage reforms going forwards, because having the benchmark bidding system be based upon a fee-for-service benchmark in a county where maybe the fee-for-service program is a minority of beneficiaries, and that population might be different than the fee-for-service. The fee-for-service and Medicare Advantage populations might be distinctly different in, say, a population that is 90% MA and 10% fee-for-service. So I do think we need to have some serious thoughts about modernizing the program for the future, since it is going to be the majority.
Okay, we're going to wrap up, and I'm going to give everyone kind of one last minute to leave us with, well, I don't know if a note of optimism is the right way to frame it, but leave us with something as, again, we need to make these decisions sooner rather than later, because we're already kind of too late and the longer we wait, the harder it is to make these changes quickly enough to, spread out the pain and the gain in some cases. So as we think about having 6 more years left of solvency in HI and about a decade left in Social Security, what's your takeaway for everyone watching who have stayed with us the whole time and have asked a lot of good questions that we weren't able to get to? But I'll let everyone kind of wrap up for a minute with their kind of concluding thoughts. And why don't we go in reverse order? We'll start with Brian, and we'll then go to Jeannie, Kathleen, and Chuck.
So concluding thoughts is I'm actually going to be an optimist. I think we can actually solve these problems. I think we can work together and do it, and it's very, very doable. And I think we have to have targeted incremental reforms over time that are operational, looking at program design. I think, obviously we need to think about ways to decrease spending more when we are already increasing our share of GDP for the entire sector. Is probably not a winning solution for economic growth. So I think we need to think about cost containment, but in a way that doesn't hurt beneficiaries and preserves the program for the future, because selfishly, I think we all want to be able to participate in it. Thank you.
So I'll actually, a pretty narrow point, but something that stuck out to me was just the share of spending that's Part A is decreasing over time. And so the sooner, if we're going to make any changes to Medicare Advantage, the sooner we do it, actually, the more credit we get for the trust fund, which could make at least solving that problem a little bit less painful. And then at the same time, even though we're focusing, and I focused a lot of my comments on Medicare Advantage, we can't forget traditional Medicare. It is still, even if it's not a majority of the program anymore, it is still a whole lot of beneficiaries, often the more vulnerable beneficiaries. And so I think we do have to keep that in mind. And I think the point about how you compare between Medicare Advantage and traditional Medicare is very important. It's there really is, it's very difficult to do. And there's a lack of evidence really that does it very well.
I share Brian's optimism, honestly. I think Social Security is an incredibly important program. Almost everyone in our whole society participates, whether as a worker paying in, a survivor, or person who becomes disabled getting disability or survivor's benefits. Then, of course, we all hope to get Social Security when we retire. It's incredibly popular up and down the income scale across party lines, and people really want to fix it. They really want to make sure that it's fully financed and that it'll work. And I think that ultimately, maybe not today, but ultimately will motivate our policymakers to sit down and figure this out. And the problem really is manageable. We are a very wealthy nation. The long-term financing gap in Social Security amounts to about 1% of our GDP. We can do this. We can afford to pay promised benefits. We can afford to have a program that continues to work as well as it has for generations. And I really think that when push comes to shove, we will.
I think my optimistic note is that I think we may be reaching the end of a decade of bipartisan drift towards worsening fiscal irresponsibility. As recently as, certainly 10, 15 years ago, there was a recognition that on Social Security, we were going to have to split the difference between more revenues and slower cost growth. And the same was true even on the healthcare side. The early days of the debate over the Affordable Care Act involved a pitch that healthcare reform was necessary as fiscal reform. Now, since that time, the debate on both issues has drifted to a point where there's no problem politicians see that promising additional benefits won't solve. So we're going to keep promising more Social Security benefits that we can't finance, and we're going to keep expanding federal healthcare programs beyond what we already can't afford. But I think that may be coming to an end. I think we've reached the limit of our ability to push that strategy both economically and politically. And now that very uncomfortable inflation has been unleashed, we're looking at the risks of higher interest rates going forward. Now I think we're starting to see a new discomfort with just continuing to promise more and more without a means of financing it. So I think we're at a pivot point. I think we may get things turned around in terms of the dynamics, and I'm hopeful that we can do it soon.
All right, well, I really want to express our sincere thanks to the panelists and anyone who wrote in questions and who attended this event. We will be having more of these. Our Trust Fund Solutions Initiative works all year round to bring you the latest news and analysis on Social Security and Medicare, and I hope to see you all at an event again very soon. Thank you so much.